Hello, hello. Sound test. Hello, hello. Sound test. One, two, three.
Hello, sound. Okay. Hello, sound test. Hello, sound test. One, two, three.
As- Assalamu alaikum warahmatullahi wabarakatuh. Very good afternoon. Welcome to the Housemanship Talk 2025. Before we begin, I would like to make a few important announcements for everyone's attention. Number one, kindly ensure that your microphones are turned off throughout the ceremony except during the Q&A session. Second, we would also appreciate if all guests could turn on their camera for more engagement. Ladies and gentlemen, we are honored to welcome our distinguished guest, Dr. Liana Alia, a medical officer at Hibari Clinic, Mon Chiara, Dr. Nur Nasuha, a medical officer at Hospital Sultanah Nur Zahirah, Kuala Terengganu, Dr. Stephen, a medical officer at Hospital Sultan Abdul Aziz Shah, and last but not least, Dr. Keshov Chabra, a medical officer at USM Health Campus, Kelantan. Ladies and gentlemen, to bless today's ceremony, we would like to invite Mr. Muhammad Fahim Shamsuddin Danish Shahmi to lead the recitation of the prayer.
نبي الكريم وعلى آله وأصحابه الكرام الفاتحة. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين. إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد أشرف الأنبياء والمرسلين وعلى آله وصحبه أجمعين. Ya Allah, Ya Rahman, Ya Rahim, we gather here today to express our gratitude for your countless and priceless blessings. Make us among your servants, whether for the little or for the abundant favors you bestow upon us. Ya Allah, the most gracious, the most merciful, bless and shower your mercy upon the cause of this event, Housemanship Talk today. Truly, you are here seeking your vast knowledge in order to expand our understanding as your servants whom you are pleased with. Therefore, bless and grace this gathering of ours. Grant us your knowledge, Ya Allah. Enlighten our hearts with your light and guidance so that we may easily accept, appreciate, and practice it. Ya Allah, O possessor of glory and honor, bestow upon us health of our body, sharpness of mind, calmness of soul, and strength of spirit. With these, may we be able to face challenges, be competitive, and uplift the dignity of ourselves, our families, our community, and our nation. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على سيدنا محمد وعلى آله وصحبه وسلم والحمد لله رب العالمين آمين آمين يا رب العالمين.
Amin, 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 ya Rabbal Alameen. Thank you to Mr. Muhammad Fahim Shamsuddin for the meaningful prayer just now. Ladies and gentlemen, before we begin our event today, allow me to introduce our honored guests. All of them share a special bond, not only through their outstanding contributions to the medical field, but also as a proud alumni of the Doctor of Medicine program from University Putra Malaysia. First, we have Dr. Liana, who has served in key departments including anesthesiology, obstetrics and gynecology, and specialized surgical units focusing on liver and pancreatic conditions. Next, we have Dr. Nur Nasuha binti Zulkarnai, who began her career in Hospital Sultanah Nur Zahirah, Kuala Terengganu, with a special interest in pediatrics. She is currently pursuing her pathway toward becoming a pediatrician. Next, Dr. Stephen, a Malaysian Medical Association gold medalist and MRCP UK candidate. Dr. Lee has served in several prominent institutions, including Hospital Kuala Lumpur and Hospital Tuanku Jaafar. He is also involved in antimicrobial stewardship and has ongoing clinical research in nephrology and internal medicine. Finally, we have Dr. Keshov Chabra. With a solid background in orthopedics, Dr. Keshov has contributed to various clinical publications and actively engages in surgical innovation and medical education. Ladies and gentlemen, before we begin to this sharing session, let's have a short thought exchange with the audience, shall we? Guys, according to your knowledge right now, how do you think housemanship in Malaysia looks like? You can answer the menti.com link that is pasted on the slide right now. All of you are invited to enter the code on the screen and join the Menti link. The link is also in the chat box. Go on, guys, share your thoughts. It seems that all of our participants have a lot of different various thoughts about housemanship. Well, thank you everyone for sharing your thoughts. Well, respected guests, now that we have done the first sharing session, it is now to do the real one. The event will now continue with the sharing session, housemanship, roles, responsibilities, and expectations. With that, I would like to invite Dr. Nasuha to deliver a brief yet informative talk. With all due respect, please welcome Dr. Nasuha.
Hi, Bismillahirrahmanirrahim. Assalamualaikum and good evening to my juniors, doctors to be, and also respected and honorable seniors. Okay, so I will briefly explain regarding housemanship current curriculum because currently we have a very huge difference regarding houseman curriculum compared to previous years. Okay, so can my okay. Okay, can okay. So basically, housemanship is apa? You become a doctor after you finish 5 years of study. Okay, in medical. So being a housemanship, all decision made will be supervised by your MOs and also specialists. Okay. So regarding curriculum of housemanship, can you move this slide? Next. Okay. So compared to previous whereby I being a houseman, okay, during my time, 2 years of housemanship, but this year they started to implement that housemanship will be 1 year duration. Okay, starting dengan starting first year of housemanship. Okay, so within 1 year of housemanship, so you have to enter only major posting. So major posting will be include medical, ONG, and also surgical. Okay, so PITS and also orthopedics sadly will be as a minor posting. So in 1 year duration, you will be compared to only 3 posting. So there's not much exposure for you to learn because only 1 year to finish all this posting. And then after you finish 1 year of the major posting, you will be enter to elective posting. So in during my year and also previous year, the elective posting got 3 posting lah. Okay, so we have KK, klinik kesihatan, we have psychiatry and also emergency. And also sorry, one more is NS. Okay, you have 4. But nowadays, this year, they try to implement is only emergency department as elective posting. So you only can enter emergency lah. Okay, so after that, you will be entered as a floating MO to PITS and also orthopedics. Okay, the minor posting. But this curriculum not really implemented yet lah. But what we heard will be implemented soon. But currently, they try to put fourth year also. They try to put PITS and also orthopedic after houseman enter the major posting, meaning that 1 year of housemanship enter medical, surgical and obstetric, then will be enter pediatric. So so currently in my hospital, we only have 9 housemanship in pediatric department. So it's very sad and also tiring for us as a MO because we have to do lots of houseman job, okay, including discharge, blood taking, and also all other things lah, ordering bloods, X-ray apa semua. And then, but I think this idea not really relevant lah for me lah, because pediatric is a big posting, also important posting. Okay, because we have about 200 patients and only nine housemen. So for MOs, it's very tiring. Okay, so we move to the next slide. Okay, so during housemanship, you will encounter multiple episodes of ups and downs. Love and hate during housemanship is common. Okay, so mainly for yourself, you will loss of self-care. You will sometimes neglect of yourself lah. And then your emotion will be affected, mental, physical, and also health will be affected because you have no time to take care of yourself because you're too busy with the housemanship job. And then going back at home, you feel tired, so you just rest. Okay, you forgot to take care of yourself. And then regarding the job, because of currently housemen also not many, so there will be a lot of burden for you, and it will cause you to have a burnout. Okay, because of the lack of manpower and everything, staffness will not take to you at the same time. So it's a very stressful situation. So, but what you need to know is you have to prioritize what is important, and also time management is very important. And then learn for adaptation, because every posting you enter, there is a period of tagging. So the tagging period will help you to adapt with the current posting, because because every posting is very different in terms of the management, in terms of the environment, in terms of the colleague. Okay, so others like families, friends, partner, co-worker, we can choose what people that we love to work, but you cannot choose people that you hate to work, because sometimes if you work with someone that always MCs, they always got leave, they always EL, it's very stress for you, because you have to do her or his job. Okay, so next slide. Okay, so you need to ask yourself before you enter housemanship, are you prepared? Because housemanship period is very challenging. Okay, very challenging. Some more, the next they plan to do in 1 year is very tough and also very packed. Okay, so next. Okay, so how academically prepared you must be. So apply knowledge, whatever the knowledge that you learned from first to 5 years of study, you need to apply back during housemanship. So you need to know what the red reflex, because this red reflex will help us in terms of prioritizing the patient, in terms of we know that, oh, this is emergency, we have to see this patient first. Okay, and then the clerking also must be comprehensive. So what you learn in first year and until 5 years of study, you must apply back to your during your housemanship, because nowadays what I saw, the clerking very very superficial, not much of negative relevance. Relevance is really helpful for you to narrow down the diagnosis. So if the clerking just superficial, it's not really help your MOs. Okay, so sign and symptom approach. So you will be with patient most of the time, compare your MOs and also specialists, because MOs and specialists have to go to clinic, have to settle referrals and other things. Okay, so once staff nurse will note it to you, everything staff nurse will note it to you. Doctor, this patient is tachycardic. Doctor, this patient have fever. Doctor, this patient is tachypneic. So you have to know what is the causes of this symptom. Okay, not mainly, okay, tak apalah doktor, tak apalah akak just bagi oxygen. Just put on a prong oxygen. It cannot be like that. You must know what is the causes of the shortness of breath, what is the causes of tachycardic, what is causes of the other symptom. Okay, so that after that, you do the investigation, what necessarily you have to do. So if patient tachycardic, how tachycardic is it? Okay, do an ECG, take some check for the hydration, and then do some bloods lah. Okay, so apart from that, being a houseman, you have be proactive. You have to volunteer yourself and also participate. Okay, so nowadays what I saw is houseman didn't follow MOs round or specialist round. I don't know, maybe because of the lack of manpower also. But for me, it is important for you guys to follow MOs and also specialists, because it helps you to learn about the diagnosis and also the management. And then some of you might feel like macam, alamak, I tak confident lah. I rasa macam tak tahulah. So try to volunteer yourself, because your MOs won't leave you alone. They will help you most of the time. Okay, especially in doing the procedures. Take your chance to do procedures a lot. Okay, offer yourself. Some MOs, they didn't ask you to do procedure. They will do by themselves because they think it is easy for me and fast to finish the procedure. But it's okay for you to ask a doctor, can I do this? Can I learn to do this? Okay, can you teach me to do this? Because it's very happy to do, it's very macam seronok to work if you have a chance to do the procedure. Okay, not just a clerking. Being a clerk is not a doctor. Okay, so after you encounter all those symptoms and signs, try to came up with the management including the investigation and also treatment. Okay, so if patient complain of SOB, what you need to do, and then one you know, okay, I think this is might be the cause. So you do investigation what you want to confirm your diagnosis, and then management. So from Houseman, we as a MOs or specialists, we don't expect very comprehensive, very correct management, very macam complete management. We expect you to pick up the right reflex to know what you need to do in the first place before your MOs come to attend the patient. So to conclude is mainly we need you to be a safe doctor because you are our frontliner. Okay, because we not all the time being with the patient. Okay. Okay, next. Okay. So regarding enhancement placement, so the system will be changed throughout the time. Even though me currently as MO contract also, the system change. I don't know lah. So multiple times untuk contract, untuk permanent posting have been postponed. So next placement for permanent is in June. So the system is very changed. So previously is based on first come first serve, meaning that kalau you cepat log in that web, you can choose what hospital that you want. But currently they will give 3 options for you to choose. And then one of the option will be you have to choose is Sabah and Sarawak. So there's no option really for you to choose your favorite hospital. Okay, because of the new rules of the KKM. So system will be changed. So I'm not sure in the future how, but this is some guide that I use to choose hospital during my housemanship. Okay, I'm from Kedah, but I choose my hospital to do for housemanship in Terengganu because you must have an aim what you want. Whether you want a busy hospital, you want to learn a lot, you want to have experience, is based on your aim. So your aim must be clear. Okay. And then environment. So environment is very important. We know that all hospital toxic, usually you cannot choose toxic or non-toxic. But but I mentioned this because at least you can choose least toxic hospital because it's very important for your mental health. Okay, big and district hospital, there is also a difference because some person they said that big hospital you will learn a lot and district hospital you will learn only limited and see cases very limited case because from district you will transfer patient to big hospital. So I mean the continuous of care tu you susah nak dapat sikit. So but for me both the big and also district hospital you can learn. Okay, you can learn something. Okay, so in district hospital mainly they will focus more on stabilizing the patient before transfer to big hospital. But big hospital we have very sub specialists, so you can see the management more thoroughly. Okay, and then for transportation, transportation what I mean is if you choose hospital that far from your house, you must consider regarding transportation, how easy accessible the hospital to go back to your home. Like I chose Zahira. I didn't think actually about the transportation. Actually menyesal sikit lah because of the transportation, because from Terengganu to go back to Kedah, you have to go road ikut Geri. So it took about 7 hours. And then if you want to go by flight, you have to transit. So so it took about RM1,000 pergi sahaja if you took a flight. So come back is about another 1,000. So you have to consider that part also, even though it's at least important. Okay, so support, if you think your family support is important for you, so choose hospital that close to your house. Okay, so if you think your friends or you don't care, so you can choose far from your house. Like for me, I choose Terengganu because it's near beach. It's very beautiful lah. Okay, so bila stress je after finish work, so I can go to beach, lepak-lepak kejap kat situ. Okay, so next. Okay, so related as a houseman, like I said, you will be busy. You don't have your own biological clocks. Okay, working hours is about 60 to 80 hours per week. And then every time you enter new posting, there will a tagging period. Depends on posting actually. Some posting, they will say that tagging period is about 1 week. Some posting they will cut down to they will extend to 2 weeks. It depends on your performance juga. So to off-tag, there's some requirement that you need to fulfill. It depends on the department itself. Okay, so tagging period is the most tiring period because you have to go back at 10 p.m. So sometimes you cannot go back home at 10 p.m. Sometimes you have to go back at 12 until at least 12 midnight if not yet settle your jobs. Okay, next. Okay, so on call will be from sorry, this is silap sikit, typo sikit. So on call shift usually will be from 6 p.m. until 9 a.m. So some hospital they start at 7 p.m. until 9 a.m. So in my previous hospital pukul 6 dah start dah. Okay, on call. So regarding leave, sadly about leave, so it's very hard for you to ask for leave also because it depends of the houseman juga in each department. So if houseman cukup, they may allow about 3 to 4 housemen per day for leave. And then you will get 1 off per week. Okay, so because they limit the number of housemen is because of tak cukup houseman, and the second they standby untuk yang EL and also MCs. So one advice is don't overuse your MC or EL because bila you use your MCs unnecessarily, it will cause burden to your friends. Very burden to your friends. Because yelah tak cukup houseman, so you keep on MC and then your jobs tu kena ambil alih by other houseman. So it's very, for me, not ethical lah. So, okay, next. Okay, so my final words, just enjoy your houseman, love yourself, make sure find times to healing, okay, to take care of yourself, and don't push too hard on yourself, and also know your limits. Sometimes you will feel depressed, feel down because you not manage the patient properly, and then until patient collapse. So it's okay, you learn from your mistake and then get back up. Okay, so mental health is very important, and then you must find someone to share your emotion and also feelings. Don't keep own by yourself, because if you always keep not express your feeling, it will affect your mental health and also your jobs. Okay, so you need to have a clear aim and vision every day. Before going to hospital, okay, aim what I want to do today, what I want to achieve today. Okay, today I want to do LP, so today I want to take a blood taking, today I want to be a good bronchiologist. So focus on your aim. Today I want to be a good clerking. So if you have an aim, so you need to go with your aim. So kalau you aim macam nak buat LP, so fine, go to other wards or ask your friend, ada tak prosedur nak buat hari ni, ada tak LP nak buat hari ni. Okay, so others than that is your hubungan dengan Allah and also with people. Okay, so what I mean is you have to pray a lot and also be kind to other people, be kind to your colleagues. Don't leave your don't leave your unfinished work to your colleague unnecessarily. Okay. This memang akan banyak berlaku dalam houseman. Okay, last but not least, don't forget to fall in love lah. Because you're too busy, you forgot to fall in love. So please find some partner yang if you not have yet. Okay, thank you.
All right. Thank you so much, Dr. Nasuha, for the presentation just now. Your sharing has not only given us clearer understanding of what housemanship truly entails, but it also served as a source of motivation and reassurance. All right, audience. Next, the event will continue with the session on panel talk, realities of housemanship. In this session, we'll hear first-hand accounts of the real-life challenges, lessons, and insights from those who have walked the path, all in an open and honest discussion. We'd now like to invite Ms. Safia Mohammed Ayub as moderator to guide us along this session, alongside our panelists Dr. Liana, Dr. Stephen, and Dr. Keshov. Let them take the stage.
Assalamualaikum and a very good day to everyone once again. Welcome to the panel session of our program, Housemanship in Malaysia, What to Expect and How to Thrive. I'm Safia Muhammad Ayub, final year medical student from UPM, and I'll be your moderator for today. We are truly honored to have three experienced doctors with us today. All of them are currently working as medical officers in their respective fields, who are also our alumni, Dr. Stephen, Dr. Liana, and also Dr. Keshov. They have been through what we call the Terrifying Houseman program. So we are here today to listen more to their experience, learn from their mistakes, and getting some tips and tricks to survive housemanship. It's going to be more like a sharing session, so I hope everyone enjoys and gains something from this. So let's get started. So there's a saying that goes, the first day is always a roller coaster. My first question would be for our own medical officer, Dr. Stephen. Doctor, can we just rewind back to your first day of housemanship? How did you feel on that day? Was it more towards feeling nervous or excited?
First of all, hello everyone. Can you all hear me?
Yes,
Am I
sir.
clear?
Yeah.
All right. Okay. So nice to meet you all. I'm Stephen here. So I actually entered my housemanship in 2020. It was very quite for me. It was quite long ago. Actually, I couldn't really remember what happened during the first day. Just like the day when Safia joined my clinic. Actually, I told her also. I really couldn't remember during my first day. But when I tried to recall, it was more to excitement. So I was very excited to put my knowledge into use. Okay, and I was very excited to really touch life because I know when I was a medical student, sometimes when we want to examine patients, we might get a lot of refusal because we are just students, right? So this is the time for me to really examine them, to provide care that I think that I can provide to them. So I think more to excitement instead of nervousness. But I really couldn't remember the first time. I think for the first week we will have some taggings and stuff, but yeah, I was in orthopedic as my first posting. That's what I remembered. I think it was a pretty good start because in orthopedic, Keshov, I think you know more because in orthopedic, I was in HKL. I did my housemanship in HKL. So orthopedic is a quite a chill posting because it doesn't have. It was not as busy as medical. All right, and you can learn some basic blood taking, some clucking and everything. So I think it was a very good starting ground for me instead of just suddenly put into a very busy place, or if let's say I put into the peds, I'll be very panicked because peds, the blood taking is so different compared to adult, right? So I think orthopedic is a very good place for me to start out with. So I was quite happy back then when I was doing my first posting.
All right. Thank you, Doctor.
Yeah.
Really appreciate you taking us back to your first day memories. Because usually as medical student final year, I think like everyone fears orthopedics a lot. So having that posting as your first day, I thought was challenging, but the fact that you enjoyed it kind of anticipate me for my first day of housemanship. Okay, so can we continue the session with our next panelist? So like I've mentioned, as a medical student myself, there are many things that I wish people could have told me before I embark on this medical school journey. So Dr. Keshov, what is that one thing you wish someone had told you before starting your housemanship?
Hello, hi everyone. Can you hear me? Yeah. So I wish everyone told me that before I start housemanship that it's okay to sometimes to not know everything. Okay. You often think that in medical school that you have the answers for all the questions, you study all the books, you know what is the answer for the questions that are coming soon. But when you go to start housemanship, it's totally a different scenario. So it's okay to not know everything, but you must have a very good good mindset. You must have a good attitude. You must have a responsibility. So, example, if you don't know how to manage a certain condition in the ward, you have to read it up and you have to ask for help. So never be afraid to ask for help. So example, if you the nurse come and told you that this patient's blood glucose level is high 2023, of course you need to know how to manage hyperglycemia. That's the basic bread and butter, okay, as in a medical posting. But if you're not sure, always ask your seniors, ask your medical officers. I'm sure they will not scold you, but once you already know what's the management, you have to learn it and don't repeat any mistakes. Like if you know that hypokalemia, you need to correct it fast. Hyperkalemia, you need to correct it. Learn once and every day learn something at once at one time. So during my housemanship time, I always told myself I will learn one thing at a day. So along the way, I increased it to 3 to 5 things. I want to learn 5 things a day. So it's okay not to know everything, but pick it up along the way, one thing at a time. Keep a notebook with you and progress. You will feel that you have improved a lot. One step a day also, it's a major improvement in yourself. Yeah.
That's some powerful takeaway from Dr. Keshov. Is the
Yeah.
things that you only learn the hard way. So thank you, Dr. Keshov, for saying it out loud.
Yeah.
Dr. Steven, about your first day in orthopedics, can I just ask, like after you graduated, we'll have some period of time where we don't touch any books. So given that orthopedic is such a subspecialty, it's like a subspecialty, do we have to like study beforehand before we enter the first day of our husbandship?
Um, I just got to know that nowadays your Venus housemanship is 1 year, cut down to 1 year. Am I right?
Yes,
And
doctor, like
and,
what Dr. Nasuha
and
presented.
orthopedic is optional. Am I right?
It's like a minor posting where we
Minor.
are doing it as a junior MO.
Oh, okay. So
Like floating MO.
floating. Okay, okay.
Okay.
I think I really lost touch for very long because during our time, basically, orthopedic is considered as a major posting, lah. Okay, and yeah, so to answer your question, okay, basically you are asking what I did in the waiting period. Am I right? Is that what you're asking?
Yes, like any
Okay.
preparation before your first day.
To be really honest, even when I was in medical school, I really want to do internal medicine already lah. So during just right after I graduated, I'll be practicing for my MRCP Part 1 actually at the time. So I didn't stop learning. I'm still studying lah at the time of I think about 6 months time of waiting for housemanship. So when I got into it, then only I top up more knowledge on orthopedics lah. Like I say, in orthopedic, as a houseman, most importantly, we need to be safe lah. A lot of the management we learn from the MOs and also learn from the specialists, okay, and then we follow them in the OT. Of course, the learning curve is going to be very great one because as a medical student, we don't even know how to scrub, we don't know how to assist the surgeons, and those are the things that you can't learn from the books alone lah. Okay, so you still need to actually experience them yourself. Okay, and there are a lot of in my hospital per se, orthopedics are very friendly. A lot of them, even the surgeons, they're very nice, so they are willing to teach. So it's not that much of a pressure lah. But in terms of that half a year while waiting for it, I was actually preparing for my Part 1. So yeah, I was studying lah at the time.
Okay, that was actually very inspirational. So I hope my year 5 colleagues can take note lah. We should not waste our time during that 6 months period. Okay, so let's now go deeper into the realities of housemanship. So Dr. Liana, as mentioned by Dr. Nasuha just now, every houseman would go through a tagging period depending on our performances, which is quite of a new term for us. So other than what we have been briefed just now, can doctor explain more what is involved in that tagging period and what should houseman really focus on during that time?
Okay, so hi everyone. So regarding tagging period, actually, as mentioned by Dr. Nasuha, for the context, I was in Hospital Mua when I did my housemanship. So it's not exactly a tertiary hospital, but more like it is a little bit above than district. So it has a few specialists, and if needed, we do refer cases to tertiary centers. So when it comes to tagging period, I did all of mine as a 2 week, 2 week sort of tagging, and it depends the expectations of each of the tagging. It depends in each the department. So usually in my time, there will be we will be given a tagging sheet. So that means like there are a list of things that we need to do, and sort of an MO we need to report to. So they will keep track of what we have done so far, and then what we and the amount of time that is needed to complete the tagging period so far lah. Okay, so the things that you will encounter, especially in the first posting, is to get to know all the basic things first, like venipuncture, yeah, the basic blood taking. I did mine. My first housemanship tagging period was also in my first posting was also in orthopedics, so it was a lot of it was not as challenging as straight away getting into internal medicine, for example. But I was thankful that if you get good HR in your hospital, sometimes they will let you choose which posting you would want to go in first. So that is one of the things that you can consider. If do they let you choose or not? If they do, then you can choose. Then maybe this is some things that you could take into account of. So like Dr. Stephen has mentioned, it's something that you can prepare a lot of skills that you will need to learn. So procedures that you will need to take part of, things that you need to learn, such as scrubbing, for example, because these are the things that we don't encounter when we are in medical school. So what what other things that we will need to do is basically, other than the procedures, either you assist or you actually do it yourself. Okay, so maybe it will be a list of things that it's sort of like your logbook in medical or surgical posting, something like that. So like, instead of just looking at someone taking blood, you will need to carry out those things yourself. Okay, and then why is it a bit of a challenge is because you'll be really tired. And some postings, they will expect you to come as early as 7, but back in MOAS, my colleagues who started off in surgical posting, so they came as early as 5, some even earlier, because the OT, they start really early, and they expect the ward rounds to finish quite fast. So depending on the posting that you are in, the department you are in, the expectations are different. Okay, so you will need to go with the flow, but at the same time, it can take a toll on you. Okay, so just remember to have sort of breathe, and then take a moment to yourself. Like Dr. Keshov has mentioned, it's okay to not know everything, and you don't have to rush into it, because I was a first poster, and alongside with me at the time were a lot of senior posters, six posters. So when I couldn't get a granula myself, so I would ask for their help. That's one example. Yeah.
Okay. Thank you, Dr. Liana, for your explanation. That actually helps me to understand what to expect and focus during our tagging. Okay. So, and also we heard some tips that we can also do some research on the hospitals we want to consider, since some are more lenient in terms of choosing our first posting. So currently I'm wondering, to all doctors, what was the hardest or toughest posting for you during your housemanship? Maybe we can start off with Dr. Steven.
during in my hospital, I like I said, I actually practiced my housemanship in Hospital Kuala Lumpur. I mean, anyone here doing housemanship? I mean, for the audience or all our medical students, right? So I think it's quite famous, like HKL, that the most toughest one I think will be surgical lah, surgical department. Yeah. So I wouldn't use the word toxic, but it was just a bit. You just have to be careful, okay, as a houseman, okay, you have to be very careful, and then you don't, simply make mistakes, okay. You have to be very careful, and then you have to be very responsible, okay. So, to me, surgical posting is the most difficult one, because the extension rate is also very high, and it also sometimes depends on the mood of the bosses, if they feel like, they're not happy, they can just extend, based on some small minor mistakes, or they can ask for explanation letters, things like that. But so far, when I was in surgical posting, that time, it was COVID period at the time, about 2020 to 2021-ish. So it was still fine. Okay, it was not that bad. Yeah, but I also almost kena extended once, I think. Almost, I mean, because surgical posting is such a famous posting for being scary in my hospital, I just want to finish it up quick, all right? But then, like 1 week before I got out of surgical posting, I actually almost got extended that time. I'm not sure whether you all want to know about the reason why or not. Okay, if you want later, maybe I can share. Just to let you know, like my hospital, the most scary one is surgical. Yeah.
Doctor, if you're willing to share the reason, can we
Oh,
listen?
can. Okay, so it was like this. I did my surgical posting as a third poster. So third poster is not very senior and also not very junior, it's like middle lah. So I was on call that day, all right, that night, and there was this one patient admitted because she has got a fistula that is infected. Okay, so the surgeons actually did a debridement on the fistula, and then the surgeon started the person on antibiotics. So they started on like 2 antibiotics for her. It's intravenous antibiotics. So, but then the patient, ESRF patient, usually their lines are very difficult. So the first posters, they were unable to insert line for her because their antibiotics is due already, but there's no line to insert for her. So they asked me to help to insert. So I went there, I asked the person, because when you want to insert line for ESRF patient, you have to be very careful because sometimes they want to preserve the other hand to create fistula, to create the new fistula. Okay, so that's why I asked the person first. So your other hand, all right, is there any plan for future fistula creation? All right. So the patient say no, because last time they pernah do one tapak there already and it failed already. Okay, so that means it was a previous creation site. So that time I also masuk brenula at that site lah, because there's no other place already, isn't it? Takkan masuk central line in the middle of the night, right? So I just masuk my brenula over the brachial, and then we masuk the antibiotics lah. So after that, the post-call time, when they check back the notes, actually, apparently one of the, because HKL is not computerized, it's actually written down in notes, and the patient is admitted for so long already, so the note was so thick. The person who took care of the patient told that actually they want to conserve the left hand for creating fistula. So this is like the shittiest mistake that you can ever make in surgery department. If you do this, you really die straight away die. So of course, immediately I removed the brenula, I compressed it, okay, and then because I also very scared at the time. I 1 more week only, I'm leaving surgical already, and all this while I've been like performing in the posting. I really couldn't afford to be extended last minute like that. So I asked the patient, please later on, if anything, please don't say it's me. I only try to help only to put in the line to muscle the antibiotics. So I really I was so scared at the time because our surgical posting is really a bit scary. So the time was a Saturday. I don't know why they have a grand walk round on Saturday. All the consultants, because HKL is one of the vascular centers, so all the consultants, all the fierce consultants, they came for a round in the morning, and then the surgeon trying to show how well the debridement was, and then the head of department asked so what's your future plan? So they say, we want to create a new fistula on the other hand. So they open up, they saw there was a scar of the thing. So he's like asking which houseman masuk the line, but luckily the lady didn't point out was me. But I think they can find out quite easily because they can just look for the schedule and then they see who on call that day. They can just find out lah. Okay, so but the day I didn't admit on the spot because I know if I admit on the spot, I sure die one. So after like, after the ward round and everything, then I admitted to the head of department. I told the person that I was the one who inserted, but prior to that, I actually asked the patient already. The patient said it was a failed fistula site, and that's why I inserted over there. So that time I already prepared to get my extension letter already, to be really honest. But it was one of the miracles, to be honest. He didn't extend me, He just, after I talked to him on the phone, he just told me, okay, next time, please don't do that. Oh, just like that only. So I was not extended. But it was a very scary moment because I thought I really gonna extend already. Because this kind of mistake, you can ask anyone, like Keshov, you ask them. Basically, you can die already, basically. Okay, but thank God. The surgeon just let me go.
Thank you, Doctor, for the sharing. So, so we can see how a single mistake can be like a terrifying moment for housemen. So can we
just be very safe?
Yeah,
Really,
just be very safe. That's our main focus. Okay, so can we ask Dr. Keshov? Doctor, what was your most challenging posting? Perhaps like what got you into orthopedics as well?
Sure, definitely. But before that, I would like to answer one question that you asked, Dr. Steven. How was your first day in housemanship?
Okay, sure,
I
Doctor.
clearly remember my first day. After rounds, I went to the toilet on the tap and I cried because I couldn't cope. And on my first day of housemanship, I had to take care of two acute cubicles, acute and subacute, and there was shortage of housemen. So, and I was expected to perform on the first day itself. Imagine taking ABGs, dealing with collapsing patients with shortness of breath, patient with chest pain on my first day. So I remember just going to toilet and just crying and
Which
called
posting are
my
you in,
mom.
Keshov? Your first
Yeah,
posting? What posting were you?
medical.
Oh, okay.
Yeah. So when you asked Steven this question, this memory just flashed back towards me. In fact, I used to do this for, I think, for the first 2 weeks of my medical posting. Every day after rounds, go to toilet, go cry for a while. Then after that, but I told myself, at the moment I will stop crying after rounds is the improvement for me. So from that day up to now, I think it's a journey lah. Yeah. So, okay, you asked me what is my most challenging posting. In Ipoh, I think many people will say ONG lah, obstetric and gynecology. So because it's a posting that is dealing with two lives lah, mother and child lah. So it's a very fast going rotation. So I remember working in the labor room and you're dealing with patients with latent phase of labor, active phase of labor, and then there is just lycos splashing everywhere, ammo scolding, shouting, because things need to be done. So the excitement and the adrenaline rush in obstetric and gynecology is totally insane. But initially I used to hate ONG because of the tagging. We tagged for almost 2 to 3 weeks, and we used to go to work as early as 6 a.m. and then go back. On papers it's written 10 p.m., but sometimes we go back 12 midnight, 1 a.m., and we have our tagging requirements and all. So we have to deliver, I think, about 10 to 15 babies per in the tagging period. So, and you have to compete with all your colleagues for that delivery, and you don't get to deliver any baby. You have to book that labor suit. You have to be nice with your nurses. You have to have a good rapport with your MO. So I think I remember one of the nights where I wanted to stay back because I wanted to get more SVDs. Uh, but at that time, that particular time, there were three patients in labor. All of them were like 8 cm, 9 cm, and my MO who's taking care of the labor suit had a forceps delivery to attend. There was another vacuum delivery which they had to call another MO. So I remember that day I delivered three babies in like 5 minutes. Yeah. So I will never forget that incident. I think ONG, it was initially I didn't like it because of the long working hours, and there's a lot of emergencies that you need to attend to and you need to pick up as a houseman. Example, if there is a PPH, uh, cord prolapse, you have placenta abruptio, and you have abnormal CTG. So you are actually the uh, first line that the nurses will update to. And if you don't pick up the emergencies, you are in deep trouble. So, but along the way, I think I learned. I made mistakes. Definitely, I made mistakes. I got scolding, but I told myself, I will learn. I will learn, and I will learn. I need to emphasize to everybody, it is okay to get scolding. Doesn't mean if you get scolding means you are a hopeless or a useless person. It's okay to get scolding. There will be days when in your housemanship you will just get scolding, scolding, and scolding, and sometimes you will go into depression and you will even feel like quitting housemanship. But it's okay. Take the scolding as your positive, as something positive, and then learn from it. So and then don't repeat that mistake. So when you progress and don't repeat the same mistake, you will appear more smarter. You will be more confident, and people will look up to you. Even the nurses also, when along as 2 weeks, 3 weeks, I was more senior in ONG. They started looking up on you because they know that you are reliable. Of course, they know they have seen you being from the worst because you don't know anything. You don't know how to handle. You don't know how to do a VE. You don't know how to check how many cm is the os dilator. You don't know how to read a CTG. You don't know how to set a green granula. Everything, they look at you like you are the most useless person. But show your perseverance, be committed, be responsible, and just keep doing your work. Learn from your mistakes. Read something per day, and as I said, every day learn something, 1 to 3 things. And I feel throughout the posting, within the second or third month, I think I was doing much better. Uh, and I was being made to become the captain of ONG at the third month. So third month and fourth month, I was captain. So yeah, so I think ONG was one of the most difficult posting I went through, but I enjoyed and I had fun also. Yeah,
Okay.
yeah,
Thank you, Doctor. I think
yeah,
some takeaways is like do not repeat your same mistakes and always improve yourself. So
yeah.
like the most challenging posting for Dr. Keshov is ONG, and that's why he's probably doing orthopedics right now. Okay.
Definitely.
So okay, to Dr. Liana, can we hear what was the most challenging, and probably Doctor, can you add during those challenging moments, what was your biggest support system?
Okay, so I think it's quite a close call between ONG and medical for me, because what depends is actually what the turn of events in terms of like if you are a second poster or a senior poster, because as you go through housemanship, it gets better and better. Like Dr. Nasuha said, you tend to be able to make better choices, and then you are able to prioritize better. Okay, so I did mine. ONG posting was as a fourth poster, but medical as a second poster. So even as a fourth poster, I didn't think ONG was a breeze lah. I didn't really like it either in my housemanship days. But I would say because I went through medical in my second posting, so it was a bit of a challenge for me. Not because it wasn't interesting. I like my medical posting a lot. uh, Thankfully, because at the time a lot of my the housemen, the housemen in the same batch as I am, were working in the same posting as I am. So whenever you go through housemanship, you will have like a senior or someone in the same batch as yours, or someone slightly junior than you. So for me, thankfully at that time I had a lot of my batchmates of housemen in the same posting. So we had a lot of good teamwork. What was challenging for me, I feel, was mostly it's the workload, because you don't really know how to prioritize. I went from orthopedics into medical, so it's a bit of a shock in terms of the workload. So even though orthopedics, you have your days where it gets really busy, but when it comes to medical, it's a whole new world. So I think Dr. Steven can testify, but because it's his passion, so it's something that you go through. It's very interesting. It's not to say that I hated it. No, but what was challenging was because of the number of patients that you see is a lot. Turnover is high, and one minute you can see that this person is smiling at you, laughing at you, the next thing you know that he's collapsing. So those things are the things that you need to be prepared for. Like suddenly he's like gasping for air, and then you're all alone in the ward, so you don't know what to do, and your mo is somewhere else. Yeah, so those things can happen. I have had my experience where I had to accompany a patient to go for dialysis, completely fine. The patient just went in because of some infection, but his dialysis is scheduled. I accompanied the patient, and then dialysis was going on, and suddenly they said, "Oh, BP is dropping by so fast." So, so what would you do? Yeah. So these are the things that can happen when you are in medical posting. So things can happen really quickly, and it can make you overwhelmed. Okay. And I was working in hospital more, as I mentioned. So at the time, I was in the fourth floor, and there was elevator available, but the urgency of certain things that you need to do. So when you are finished with your rounds, there are things active plans that you need to carry out. Some may need ABG stat, some may need repeated potassium stat. So all these stats, you need to take it as quickly as you can, and then you need to bring the it's not that the PPK means the staff cannot bring the sample to the lab for you, but because you want the result to be fast, so you have to send it yourself. So that was my experience. So I had to go from fourth floor down, go to the send the sample to the lab, and then go back up, with the result. Yeah, things like that can happen. Yeah, and in MOA as well, we were manual. That means that there was no computerized system. So everything has to be written down and then jotted down. Even the discharge summaries, everything has to be written from day one until day 17 of admission, things like that. So as you go along, you tend to cope better. Yeah, and the kind of camaraderie that you have with your batchmates and also the staff nurses, they really help you out, really. And your MOs also, they will eventually know that, yeah, they can rely on you. So whenever they need something, then they'll like, okay, you ask the senior poster, senior in the sense that this person has been in the medical posting a bit longer than the other ones. Yeah, so that was the what was challenging for me, and that was my support system at that time. Yeah, because when it gets overwhelming, I do feel like crying, and because you don't get enough rest, and then you're expected to come to work tomorrow like nothing happened, and then sometimes you see like patients pass away, and then you still need to work, and then like dengue patients need QID blood taking, things like that. So these are the things that will somehow make you a bit shocked at first, but with the right people, the right kind of environment, yeah, you will get through it, inshallah.
Thank you, Doctor. Such a valuable sharing, and also a reminder for everyone lah that challenges are normal. And also, other than crying after rounds, we also should have a good support system, especially your teammates, your staff, and also seek help from your MOs and also your senior posters. So next question is more about debunking misconceptions. So Dr. Steven, just now you said you didn't want to mention the word toxic, but we want to ask you, like there's always a thought going, right? Housemanship is very toxic. Dr. Steven, based on your experience, especially in internal medicine, do you think this is true, or is it just a matter of perception?
Internal medicine in my I mean, throughout my service, I think internal medicine is okay. All right, but I wouldn't use the word toxic. It's actually how you want to establish the relationship with your superiors, and also your friends. Of course, there are some people who are a bit more, because you're dealing with a lot of people. Because I was in HKL, and after that I went to hospitals Seremban. All these are big hospitals, so we're dealing with a lot of people. So sometimes, after some time, you get to know the person. Because different people have different personality. Some people tend to be more irresponsible. Some people tend to be more lazy. Some people tend to be more selfish. So those that seems to be a bit like toxic kind of people, actually you have the choice to stay a little bit away from them lah. Okay, because definitely in every hospital there are also good gangs, you know, they are very, very good people, very helpful, very friendly, and very responsible. So stick together with those people. And then regarding the superiors, just try to follow their orders lah. So sometimes when they ask, uh, especially there's certain consultants or there's certain specialists where you know that they are a little bit more strict, then you need to know their pattern lor. Okay, then you don't go and purposely trigger them lah. You know, there's certain things they don't like. Like for example, in my surgical posting, there was this one surgeon who is very particular for tachycardia. So even if the heart rate is 102, he will also question you, why is the person tachycardic, you know. He will ask for questions and all that. So if you know there are certain people like this, a bit like pattern like that, then you just try to come up with reasons before you do round with him, so that he can be assured because different people are different, you know. It's all about communication skill. Regarding toxic, I really don't think that housemanship is very toxic per se. I think MO-ship is even more toxic than housemanship, because housemen are actually well protected. You as housemen, even if anything happen, the responsibility will not be on you. Housemen will not be going to mortality. Housemen will not be going to morbidity meeting. Okay, so you'll be MOs, registrars, or specialists. Okay, so the higher ranking you go, the responsibility that you bear is more. So as a houseman, the only thing that I think is taxing is the workload, okay, and also the time of work. Other than that, you will meet some good friends also during the time, okay? And of course, there are some people who are not good lah. So you tend to choose your friends.
Okay.
Yeah. So to
Understood,
me,
Doctor. So
I really don't think it's very toxic in my
Not
personal
really.
perspective. Yeah.
So we just have to be prepared and like
Yeah.
expect the
And
unexpected.
be flexible along the way. You know,
Yeah.
be very flexible. Don't be too rigid. Be very flexible. You know, the way to deal with different people is different, especially
Yeah.
superiors.
So we have to adjust ourselves.
Yes,
Right.
time to time.
Yeah, time to time. Okay, that was a very good sharing from Dr. Steven. So now that we have heard a lot of like how to deal as a houseman, let's flip the script now. Since our doctors are all medical officers right now, naturally your expectations on new house officers would have changed. So Dr. Keshov, from your experience or maybe in orthopedics, what kind of qualities or habits that you want a house officer to have? Or maybe what kind of HOs that you find easy to work with?
Okay, I think this not only for orthopedics, I think it can be applied for all postings lah. Number one, you need to have a good attitude, willing to learn, and you need to be punctual and do your work. The most important, do your work. Come to work early. If you're supposed to come in by 7 or before 7, you are there. Review all the patients that you need to review. Do your tasks, present your cases, do the basics. If you need to be referring a patient urgently, if you need to get the scans, you need to get ultrasound, you need to get CT, MRI, do your work. If you're not sure, ask your MO. Okay? Be always available. When you're working, be always available. Don't go missing. Okay? Have a good attitude, communicate well. When you see your MOs, you see your specialists, greet them, good morning, doctor, good morning, Mr. Greet even the nurses, the PPK, even the radiographer, everybody in the system, everybody in the hospital. Doesn't mean if they are PPK, they are low. Doesn't mean they are the cleaner means they are low. Everybody in the hospital is important. Everybody have their own task. If you meet somebody that you know, greet them, say good morning, have a nice day. The least you can do is just smile. Have a good attitude, be available when you are there, know when to ask for helps. Okay. Before you enter any rotation, example like for me in orthopedics, what I used to do is before I enter that particular posting, I will find out what are the emergencies that I need to know in this posting. Like for orthopedics, there are not many emergencies. There are 7 or 8 emergencies like necrotizing fasciitis, spinal shock, fat embolism syndrome. Every rotation have their own emergencies. I think the basic thing that you need to know is to cover the emergencies for every department before you enter or during the tagging period. I think the tagging period for every posting is to make sure you know how to pick up what are emergency, when to ask for help, and know what to do, what are the basics before you alert your MOs, before you alert your specialists. So know your stuff, be responsible, have a good attitude, learn. It's okay to get scolding and always smile. And you will have days which are bad. Sometimes I will label it as sometimes I'll have a day which is a bad blood taking day. It's okay, never mind. If you take the blood two, three times you can't get it, it's okay. Communicate with your friend. Maybe your friend can take it. So don't take like, oh, I'm really bad in blood taking. It's okay. Sometimes you have a bad blood taking day. Sometimes you have a bad granula day. Sometimes you have a bad CBD day. So communicate with your other colleagues. Sometimes there are people who are better in doing granula, but doesn't mean that you don't do all the granula. You have to master the skill, learn, do more, and then pick up the skill. So yeah, so know your limitations. What you can't do, ask for help, but don't burden people also. Okay, the most important thing of all the things that I said is have a good attitude and just do your work. That's all. Yeah.
Thank you, Doctor. That was such a good insight. And I'm
Yes.
sure all the year fives are taking notes on that. So
Yeah.
guys, let's try to be some easy HOs to work with and also focus on our attitude lah. Okay, so my next question would be for Dr. Liana. Doctor, aside from the quality that Dr. Keshov have mentioned, um, can you give some additional like do's and don'ts for HOs to keep in mind?
Okay, so I think it would be pretty similar, but what I would want to point out is the things that you will need to keep in mind is to persevere, because it doesn't, you know as well as all of you has mentioned, the expectation is a lot, and it's not going to be an easy days ahead, because there are things that you have to learn, you have yet to learn. So there are things that you cannot just pick up from medical school. That is the reason why you have to go through housemanship. But if you are proactive, okay, it's not exactly just a quality that we see in housemen, but it's also a skill. Okay, so if you are proactive in doing things in that department, people will notice that you care, not just because that you want to be a good houseman, but because it will shape who you are as a doctor. Okay, so when you are proactive, I think a lot of our lecturers as well in medical school, they tend to emphasize on this a lot. If you don't show that you're interested, then how will we know that you would want to become a doctor? So if you the training comes in being a house officer. So when you are proactive means that you are not scared to ask others for help, like Dr. Keshav has mentioned, that it's the same thing throughout. The staff nurses, sometimes they even know a lot more than you do, because some of them has been in that field for many years, for more than 5 years, for 10 years. Okay, sometimes in ONG, the midwives, it's like they just like kacang only lah, like that, because they have been through it so many times and they know it better than you do, especially when you're new to the department. So it's okay if you want to ask for their help. It's okay if you want to ask, is this correct or not? And if you are proactive and they see that you are sincerely trying to learn, you are sincerely trying to help the patient, sometimes they even will alert you, doctor, I don't think that's the correct regime, for example. If patient is hyperkalemic, and then your specialist say, okay, I take two lah, like that. And sometimes you have to key in all the medication required, and it might not be in the correct order, for example. Okay, so sometimes they will be the one who will alert you, and they will be the one who tell you, oh, okay, I think you should check again if this is correct or not. You are able to avoid these mistakes when they see that you are sincerely trying to go through the posting, by doing your best. Okay, so it's never a wrong thing to be proactive. Okay, when you are asking, when you are um, learning from your MOs, it's always okay to be wrong at first, but that does not mean that you are always wrong. So it's a skill that you will be learning more and more every day, and then you'll be better at it. And you can gain the confidence in yourself as well as you go through it, and then you'll be like, okay, I've been through this before, I've seen this case before, so now I can manage it better. Okay, so it's to be proactive throughout all of your posting.
Okay, Doctor. So like we just have to improve ourselves from day to day and just know that we can be better as long as we are willing to learn and make ourselves better.
Yeah.
Okay. So before we end, I think I wanna ask maybe Dr. Steven, aside from preparing for your MRCP, while you are a student, and of course some reminders to students currently, what can we do right now to prepare ourselves better for housemanship?
Yeah, actually, I was a bit afraid that you will ask me what I expect from my houseman because I've never had houseman before throughout my service. Okay, HKL, Seremban, HSAS, never had any houseman, but I deal with a lot of medical students. Okay, so number one, as medical student, I think you have to equip yourself with the most knowledge as possible. Like I said, it's never enough. Knowledge is never enough. There's no matter how far we go, also the more you learn, the more you realize that actually there are more things that you don't know, right? But as a medical student, you must first equip yourself with knowledge first. And number two, that's what I notice lah nowadays. Okay, is that what Keshov said also, the attitude problem lah. Okay, the basic manners of greeting doctors, basic manners of asking permission before joining ward rounds or before joining clinics. Attitude is really, really important, because if your attitude is not good, no matter how good your knowledge is, people will don't care about that. Okay, attitude is always number one. All right, punctuality is another thing. All right, I mean, these are the quality that I see lah. Because if punctuality is gone, I won't trust the person, because if you don't respect time, what other things that I can expect you? Personally, for me, punctuality is number one thing lah. Okay, and then besides attitude wise is to ask questions. Okay, because lately I noticed that a lot of medical students, they don't ask questions, so that's why I have to ask questions. Am I right, Safia? All right, it's like you all don't know what questions to ask, or because maybe you all are too afraid to ask questions. I don't know. Okay, because when I was a medical student, I asked a lot of questions because I noticed the more I learn about something, the more I don't know about it. So I need someone who has been through it to teach me. What I noticed about medical students is you all tend to go in a gang of medical students only. So what do you think your friend know better than you? You understand what I mean? Because you're going together with your friend. Your level of understanding is the same, So your friend can't help you improve too much. If you really want to be better, you have to approach people who have been through it. Then only they can guide you through and they can point out what your mistake is. Because if you, like, a lot of times I saw medical students, they go and examine cases, for example, okay? So they examine. I purposely will go inside and kacau them one, okay? I ask them to examine one time for me. The examination technique is all wrong. And when I ask the other friend, do you think anything is wrong? They can't point out. Or maybe they are too shy to point out because it's their friend, right? They don't want to like malukan their friend. So that's the problem when you're going with your friends. Your friends sometimes want to juggle your perasaan. It's not like they don't want to share with you because they're afraid that if they tell you frankly, might hurt your feeling, right? But for me, you want to improve, I must tell you the truth. If I hide the truth from you, then I'm really hurting you. So that's why if you follow my clinics or if you follow my class, if you follow my bedside teaching, I'll be very, very frank to you because I want you to be good, okay? And like I said, medical school is the time where you're really allowed to make mistakes and don't have the ego in you, please. A lot of medical students, because you guys were top students when you're in SPM, when you're in matriculation, that one is already past tense already, okay? So don't keep the ego in you thinking like you are still the best, you're not allowed to make mistakes. There's no such thing, please, okay? I mean, we are learning, right? So it's always okay to ask. It's always okay to ask, all right, and make mistakes. So don't keep that ego in you. A lot of, I don't know whether year 5 got or not, okay? A lot of this ego still inside, thinking that you guys are not allowed to make mistakes. You guys are the best like that. It's not like that. Humble down yourself, okay? And remember that making mistakes is really fine, okay? And you need to learn how to overcome failures, okay? Because every one of us in our life, we will meet failure one day. You must know how to overcome failure and how to, stand up from failure. That's the most important thing, Okay, so yeah, medical students, that's the thing lah. That I think.
Thank you,
Mm,
Doctor. So
mm.
like, especially year 5, let's start taking small steps today, ask more questions, be more
Yeah.
proactive, and
Why?
also be
Just join
humble.
rounds, just join clinic. And when you join clinic, you try to participate in the
Yeah.
discussion. I mean, Safia, you are very good lah. At least when I examine patient, you examine after that. But
Okay.
not everyone is like you. Some people, they just stood behind the whole time, writing down notes. You have to participate. You have to ask questions like, oh, doctor, why you manage this patient like that? Why just now the patient you manage as such? Then only you learn, ma. You just stand behind seeing me clucking the patient, giving things. You know what is running in my mind, man? You know why I want to do that, man? You don't know, right? And we don't have time to teach you one by one because we have so many patients in the clinics. Correct or not? So you have to
Very
ask
true.
questions.
Yep. And also by asking questions, maybe we can remember better and also
Yeah.
test our understandings.
And we remember Parkinson?
Yeah, remember, Doctor. Very good
Okay.
class with
All
you
right.
that day.
Okay.
Okay. Okay, so that was such a very wise advice from Dr. Steven. So before we wrap up everything, I would like to ask Dr. Keshov, Doctor, any tips like what Dr. Steven has mentioned, and also any words of encouragement that you would like to give to students who are actually feeling quite overwhelmed and also anxious about the upcoming housemanship?
Okay, I think being anxious is it's normal lah because you will be thinking I need to meet the expectation and all. But chill housemanship is fun. I really enjoyed it and I had good bunch of friends, colleagues. Enjoy housemanship. Take it as a learning process and take breaks whenever you need. I mean, when you have a rest day, take a good rest, watch a movie, go out with your friends, eat what you like to eat. And then housemanship, you will be busy carrying out plans and all, but don't forget to eat, to go to toilet. Don't forget all these basic things. Things that are urgent need to be done urgently. Things can wait for a few minutes or for some time. Make sure you go and have your meal. Make sure you go to the toilet for your pee break. Make sure if you need to get a drink from the co-op, just go 5 minutes, get a drink. There is time for everything. Balance yourself. It's enjoyable. The process is good, and I look forward to go to work every day because I really enjoy. You shouldn't have that mindset that it's going to be a busy day. I'm gonna be stressed. I'm going to be depressed. Have that good mindset that it's going to be a good day. I'm going to learn something new today. It's okay if I get scolding, but I will not repeat my mistakes. I'll have a good attitude. I will enjoy life. I will learn something every day and I'll be a better person. And the last thing is be sincere to your patient. Okay, treat every patient is like your own parents. If you see an elderly female, think of it like if that's your grandmother. If you see a elderly man as your dad, treat him like how would you treat your dad, your grandparents, a lady patient treat as your sister. Then you will start thinking, you will give the best for that patient. If you don't connect with the patient, you won't do your best. So do your best for every patient, thinking that if this is my family member, how would I treat? Would you be happy if someone else treated your parents or your family members the suboptimal way? So always think of that, and yeah, be happy, smile, have fun, make good friends, be good with your MO specialists, your colleagues, and help those who are struggling. Don't forget our friends who are struggling. Okay, give them some encouragement, help them when they need, and yeah, that's it.
Thank you, Dr. Keshav.
Yeah.
How about Dr. Liana? Doctor, any final words of encouragement for the students?
I would like to say that, like all things in life, things do get better. So there is light at the end of the tunnel. It's not always so scary as it sounds. And like I enjoyed my housemanship as well. And the friends you make throughout housemanship, you will remember them a lot because some of them, even though you disperse throughout different hospitals, maybe all over the country, but you will remember all the good times, all the bad times as well. So these are the things that you learn as you go forward. So don't be so scared of what is going to happen, but take it as a positive thing, as a positive mindset, and like everything else, practice always makes perfect. So even if you're not really technically good at something in the beginning, but you will be in the end, inshallah.
Thank you, Doctor. And also, I think we have come to the end of our panel session. Thank you so much, doctors, for sharing such honest and heartfelt insights with us today. To everyone here, I hope you have gained more clarity, confidence, and calmness about what lies ahead in houseman. And also, like what Dr. Liana said just now, housemanship is not about being perfect. It's about being a safe doctor, and you enjoy the process, try to be better every day, and also try not to repeat the mistakes. So we wish all the future HOs the very best, and may you not just survive but thrive in the journey ahead. Thank you.
Alhamdulillah, we have successfully completed our panel talk, realities of housemanship session for today. May we all gain some knowledge and be able to apply it in the future. Special thanks to our panelists Dr. Liana, Dr. Stephen, and Dr. Keshov. Also, the moderator, Ms. Safia, for guiding us throughout the session. Right, dear guests, next we will proceed with the Q&A session with our guests today. Those who wish to ask questions may speak through your microphone or type them in the chat box. Go ahead, guys.
So there's one question. There's two questions from the audience. Firstly, regarding the recent changes of horsemanship. So to all doctors, do you think the recent change is gonna affect the quality of training, especially in major postings like pediatrics? Right, we are no longer having proper training as a horseman, but we are only starting as floating at most. Do you think that's gonna give any big impacts to the quality of service? Even Dr. Nasuha can take the question.
So, because I think peace is also important to learn. From what I know is after you completed the major posting, you will be entered the elective posting where it's ED. So at ED, you will be seeing all PIDS patient. You cannot choose patient which patient that you want to treat. So when you enter ED without entering PIDS first is maybe some of things that you not able to fully manage the patient at ED. Not the diagnosis won't be correct, and so it's maybe difficult for you for branula or bloods taking. But I think it's okay because your MSO is there helping you at ED. Yeah, that's the thing.
Dr. Liana, would you like to add anything?
Truthfully, I think I didn't really agree when I heard that they were trying to compact the posting into from 2 to 1. especially when PITS and orthopedics is, it's a lot that you can learn from those postings. Even though some you may think that it's not, people's interests differs. So to choose orthopedics and pediatrics as the minor postings, it doesn't really seem fair. So as Dr. Nasuha mentioned, it could be quite tricky. Yeah, because pediatrics, like a lot of people say, they're not mini adults. They're completely different. They are little human beings who needs very very tender care, and there is very specific way of managing them. Even the fluid resuscitation is very different. Even how you correct the electrolytes is very different. So it's a lot to handle actually. And if you encounter pediatrics patients in a minor setting rather than having the whole posting by yourself, but as per our previous, it can be quite a challenge. I'm not sure how they are going to implement it. As of now, I don't really know how is their plan. But um, but I guess we can try to see how things goes first. As for orthopedics, I think I learned a lot in terms of the toilet and suturing, the skill that you have. It might seem a bit of hassle to some, but it's not something that you can necessarily. I think I learned a lot of my toilet and suturing skills from orthopedics, to be honest, rather than surgical, because surgical mostly we focus on things in the operation theater, whereas in orthopedics the toilet and suturing skills you learn in the room, which can be carried out. So so yeah. Hopefully, as you have gone through the other four postings, you will learn a lot. Sorry, the three postings, you will learn a lot. But even if you go through it as a minor posting, you can learn something. If not a lot, just a little, it's fine. Yeah.
Thank you, Doctor, for answering that. So our next question is actually quite similar. But this time I think you can focus on orthopedics. So Dr. Keshov, can you help answer? Um, Doing ortho as minor postings, is it heavy to handle as junior MO?
I think it will be a bit of a loss because I think orthopedics you have a lot of things to learn, especially on management of fractures, open fractures, uh, diabetic foot ulcers, uh, and all the infection cases and all soft tissue conditions. And but I think it's okay. You can learn it in your major postings as well. I mean, in medical, in surgical, there are many patients who have other problems as well, which we're talking about here, orthopedics. So a lot of medical patients also have DFU, and then orthopedic also go to their ward, go to medical ward to review the patients. So I think in order you want to cover orthopedics, you see the patient as a whole, and you just say you're covering medical, and the patient has got uncontrolled diabetes, patient got ACS, and the patient got also have necrotizing fasciitis and all. Use this opportunity to learn that as well, so that when you become a junior MO, then you are not too lost. So now you have to adapt with the system. I mean, we can't complain if that's the system. That's the system. So, but as a houseman, I enjoyed orthopedics because I was allowed to do bedside procedures like incision and drainage, IND. I used to get excited when my MO told me that, "Hey, you can do this IND, I'll be there, I will supervise you." So just the nick and I see the pus come out, I used to feel very excited lah. That I don't know why. And then I got to do ray amputation bedside, and I got to do toilet and suturing. So all these basic, and then debridement of infected wound, sacral sore, all this you get to do bedside. But it's okay. I think when you are a junior MO in orthopedics, you will also get all this chance. Go to OT, observe more cases, and you have the chance. You also ask the MO whether you can participate and do the cases with them together. Or it's, I think, if you have a issue here that orthopedics is not covered as a major posting, take it something positively. If you see these patients in your major posting, learn it along the way, and then when you're in your as a junior MO, also take the time to read it and I'm sure you will get the opportunity. And then orthopedics, I think you will learn along the way, and it's not too difficult as a junior MO. You can ask, and all the MOs and specialists will be more than willing to help you out. Just have the good attitude and willing to learn. Yeah.
Okay, thank you, Dr. Keshov. I think like everyone's like a bit shocked with the sudden shortening of the duration. But as
Yeah.
long as we learn what is common along the way and also participate more when we are junior MOs.
Yeah. Actually, in my hospital also now we have shortage of housemen in orthopedics as well. We're left with 4 housemen for the whole department. So we are
It's very
going from very less housemen to
uh,
no housemen. So MOs are start doing houseman work. We are also taking bloods. We are setting granulas. So be ready when you're a houseman. When you become MO, you will still do houseman work and all. Yeah.
okay, thank you, Dr. Keshov.
Yeah.
So the next question is for Dr. Steven from your very own student, Doctor. How was the working environment in Seremban, Dr. Steven?
To be honest, I only was in Seremban for a very short period of time, and the time was during the COVID time. I didn't really experience medicine thoroughly in HDJ per se, but I'll just point some good things and bad things lah. The good things is it's close to Klang Valley because my family, my wife, everyone, we are all from Klang Valley, so we don't have to get thrown to too far away. So that's the only benefit, I think. Other than that, I think in terms of because I was in COVID at the time. Okay, when I was COVID, I only occasionally joined medical clinics. So I can't tell much about that, but I can see that from the short period of stay when I was in Seremban, it was much more busier than HKL. Is from what I see. It's much busier than HKL, and then the workload is also more mainly because the amount of people working is lesser. Even though you see HKL is like a lot of patients, but the amount of people are more also.
Okay.
Yeah.
Thank you, Doctor. I'm assuming Bradley is considering Seremban to do his housemanship.
Yeah, good luck lah then.
Okay, good luck.
That's the only thing I can say. Good luck.
So the next question, hello doctors, in ED, how does the on-call works? Can we perhaps have Dr. Liana or Dr. Nasuha to answer this?
I did not have ED as my elective posting. I had anesthesia instead. So, but my husband did. But as for housemanship, I guess it I think it's a 12-hour shift if I'm not mistaken. Yeah. So what goes on in ED is also depending on the hospital that you chose. ED can be very, very, very hectic. Okay, especially if you're working in the yellow and the red zone. So things can get really rushed. You get the adrenaline rush. Some 1 minute you're seeing this patient with asthma, and then the next you need to manage some patient with a fracture, things like that. Sometimes suddenly intra-abdominal cases come. Yeah, so those are the things that need to be.
Right. To add on regarding ED, so ED, there's no on-call. They call it a shift. So we have 3 shifts in ED. So morning shift, evening shift, and also night shift. So I can't really remember each shift to how many hours. But it have 3 shifts. So mainly, if I'm not mistaken, the morning shift too, you enter at 10 a.m. and then go back at 3 a.m. So, and then after that, the evening shift will come. And then night shift, we started at 10 p.m. and also end at 10 a.m. So night shift will be quite long compared to AM and also evening shift.
Alright, very understood. Thank you, Doctor. So I think we have one more last question lah. Perhaps Dr. Keshov can take this because I'm assuming he's currently doing masters in orthopedics. Doctors, regarding specialization, As we know, Malaysia is currently under a great shortage of specialists, but the recommended number of medical officers are a little bit better. Is there any reason behind the delay of doctors starting to do their specialization?
I think the delay is because the exams, like for orthopedics, you need to take two exams. One is you have to take a MEDEX and you have to pass, you have to at least get band 4, and then you will go for another pre-master's exam in which you need to pass that. You need to go through interviews. Then the minimum requirement for orthopedics now you have to serve in orthopedics for 18 months. Last time the requirement used to be 6 months, then they increased. Now, if I'm not mistaken, it's 18 months. I think they really want you to be very well versed in what you are doing at the moment in orthopedics. Okay, because in orthopedics you'll be doing cases, you'll be doing debridements, you'll be doing amputation, you'll be doing plating, nailing. So you're expected to have some core procedures done before getting selected into masters. And of course, during masters, you will also learn along the way. But I think the requirement is you have to have a certain amount of experience in that particular field before you are eligible to be into the program. And then you need to fulfill the logbook. Like for orthopedics, you need to get a satisfactory number of cases observed, assisted, and performed. And then at the same time, if you have extra things like you have a poster publication, you have participated in a research, all these are plus points. So I think the delay is for you to get more exposure in that particular field that you are interested, and to prepare you to delve into that posting as a master student and eventually become a specialist. Talking about this in the orthopedics perspective, I'm not really sure about other department how it works. Yeah.
Can I give my take, Safia, on this?
Yes, doctor, sure. I was about to ask you anyways.
Because I'm in medical, right? So medical was having a very big revamp, I would say, lately. Because previously, I think a lot of the people, orthopedic, all this while, it's I believe it's true master pathway lah. But actually, from medical, previously, MRCP was the pathway that most of the people will be taking in. But nowadays, the paradigm shift is that it's more towards to masters also. Okay, so even if you want to do MRCP in KKM, you still have to be bonded with HLP, and then the duration of study and the service, everything is also the same as in master. Okay, so that means definitely what Rizwan said is true, that the time for us to become a specialist definitely will be longer, because you have to understand, especially like specialty like medicine. Okay, being a physician is definitely not our end goal. Okay, we still have to suspect. Physician is just doing usual ward work. If you want to do, like, for example, cardio, if you want to do like respi, if you want to do like gastro, that's another 3 or 4 years of subspecialty. Then under gastro, there's still further subspecialty that we can go in. So this delay in specialization, especially in physician, is going to slow the whole thing down a lot. Okay, but I think the reason why that the delay is happening is because there are too many people quitting, especially MO. Okay, there are too many MOs quitting already. So if there are so many MOs quitting, actually the people that need to run the service mostly is the MO running the service. So they need to retain people there. And that's the reason why also they cut down the duration of the housemanship. If you think about it, why they want to cut down the duration of housemanship from 2 years to 1 year? Because they want people to get out to become an MO faster. You understand what I mean? They need to keep people to work as MO to keep the service running. But this is not a healthy phenomenon. If you ask for my opinion, I don't think this is a healthy phenomenon, because at the end of the day, the whole system will be even more difficult for the people, and there'll be more people who are quitting because they don't see the progress. The progress is too slow. Okay, especially in certain field like in medicine, for example. Okay, being a physician is really not enough. You really have to subspec again, and that's going to take another. So the whole journey is going to be like 7-8 years to be a subspec. It's going to be too long. Okay, but that's what I think the government wants lah. They want to retain people to work as MO.
Yes. Okay. I think the explanation by Dr. Steven actually explains the new system and also answered the question from our fellow audience, Muhammad Ridwan. Okay, so I think we have come to the end of our Q&A session. I'll pass to the MC.
All right. Thank you, everyone, for the exciting questions, and a special thanks to the doctors for gracefully answering the questions as well. Okay, so everyone, everything that is good has eventually come to an end. So before the event ends, all guests are invited to turn on their cameras for the photography session.